It seems like the sun is peeping out in Gauteng. I'm not sure what's happening around the rest of the country, but it is also Braai Day. That's what it's become. But now, let's talk about something that is a little closer to our health. The World Health Organization says integration of traditional and complementary medicine can be beneficial. On this Heritage Day, we explore how healers from various backgrounds are sharing their knowledge. Dr. Bianca de Canha, President of the Homeopathy Association of South Africa, and homeopathic Dr. Tharushka Naidu joining us to discuss this very, very important and I think evolving topic as well. Bianca, welcome to you in studio, and Tharushka, welcome to you joining us on Zoom.
Hi, good afternoon.
All right. Well, yeah, we can see you. You're right behind us, snuck up on us there. We'll start with you, Bianca. And, you know, how are we seeing? We're seeing a big movement towards alternative medicine. People are exploring alternative healing. How are you seeing the merging, or what are we learning from other cultures in that space where you are right now?
So it's a really interesting question. We, as the Homeopathic Association, have started to engage with African traditional practitioners as the complementary healthcare profession in South Africa, or at least one of the prescribing practitioners that are registered with the council. We are the middle ground between our African traditional practitioners and our medical doctors. So homeopaths find themselves in this really interesting space where we are complementary, regulated by our government, and using a lot of the herbs and medicines that our African traditional practitioners are using. Now, a statistic from WITS showed that I think it's about 80% of the South African population are first using African traditional medicine before they even get to a medical doctor, which really shows you the wide acceptance of African traditional medicine. Now, we should be accessing that and utilizing that in our reach for universal healthcare. And so homeopaths are sort of navigating this space of being regulated by government, but also looking at the African traditional medicines. And where homeopathy is really quite unique is that there's lots of similarities. Even though our system is not indigenous to South Africa, there's lots of similarities between us and African traditional medicine, which is where this common ground is found.
Okay, I want to chat more about that in a moment. And Tharushka, I mean, obviously of Indian descent, as I am, we had Bianca talking about African traditional medicine. We've seen a lot of what we use, or what Indians have been using for centuries. Now we see them bottled and sold at exorbitant prices on the shelves as well. But let's talk about, how the Indian connection as well, and what we're seeing in terms of what's in our kitchens, and we've been using in our kitchens for centuries, how that has formed part of what you're doing in your space.
I think the beauty of it now is that in Indian medicine, like Ayurvedic medicine, and how it compares to homeopathy, and where we see the similarities is that we are really taking into account a patient as a whole, and we are now testing and utilizing these natural medicines in a practical and more professional space, rather than just saying, okay, it's mom's recipe or grand's recipe in the kitchen. We're now able to use it in a practical setting, and people are recognizing the benefits of natural medicine now.
Absolutely, yes, and they're definitely benefiting from it. And also in terms of, we have this BRICS association, we have BRICS countries, and again, India forming part of that. Chinese medicine as well, Bianca.
Absolutely.
I mean, just tell us, in terms of researching, you've also have to be careful. There's a safety issue involved.
Sure.
You can't just take something and say, okay, it has worked here, and let's just put it in a bottle and sell it to South Africans. So what are the protocols there?
So I think this is where our SAHPRA really does step in and regulating the medicines, making sure that we are putting meds on the shelf that are safe for use for the public. But just to pivot slightly to your point with India, very interesting statistic is India, about 30, 40 years ago, incorporated its indigenous systems, Ayurveda included, as well as homeopathy. The World Health Organization recommends a doctor-to-patient ratio of 1 doctor to every 1,000 patients. India has surpassed the World Health Organization's recommendations with 1 doctor to every 819 patients, which is spectacular when you consider that the population is 1.4 billion people. Now, in South Africa, we have a problem. our doctor-to-patient ratio sits at 1 doctor to every 3,000 plus patients. So we are severely lacking, and this is where the incorporating traditional doctors, your complementary medicines, your Ayurvedic practitioners, are really going to help us to fill that gap. So certainly, all of us are Portuguese descent, and all of our grannies also had their things that they advised. And certainly these things are safe and effective and have been used for centuries. But we need to be using them responsibly.
Yeah, and in the right way, the right combinations, I would imagine.
Under the guidance of a practitioner who understands these things. Because back in the day, when our grands were using these things, they weren't on blood thinners and antihypertensives and anti-inflammatory drugs. So we really have to use these meds with absolute respect. Natural doesn't mean safe. It means responsibility.
And you need to have the knowledge of the traditional pharmaceutical industry as well. Tarushka, just looking at, just the benefits of all of this, are we seeing, there's always been skepticism, right, around alternative healing, but I've seen a movement, I've seen a trend of more and more people who are coming that way. What are you seeing? Are you seeing the same?
I'm seeing exactly that in private practice. I think it is more the support that patients want versus feeling a bit like a number. And because our current healthcare system is so overburdened, I think this is where complementary medicine can come in. Because specifically in homeopathy, we see the patient as a whole. And so we're offering that support and that advice that patients are looking for. So whether it be regarding their lifestyle, their sleep, their diet, even stress, which so many people, I don't think there's a person who can say they're not stressed. So this is where we come in, and patients are seeking alternative treatments, complementary medicine for this specific reason, or may it be somebody who has a chronic illness and they are just on a lot of medication, patient compliance becomes a problem, or also just experiencing so many side effects of medication that they seek complementary medicine to try and relieve these side effects.
And just to wrap up for us on your side, and I'll let you have the first go at this, Tarushka, in KZN as well. I mean, we would obviously see a lot of traditional healing, as maybe more than other parts of the country, and I could be wrong, correct me if I'm wrong. Just what associations or what conversations are you having with traditional healers there in terms of just working together and saying what works for you and what works for us, and let's put it together?
Yeah, look, I mean, during my years of study and when we were doing our internship, there were traditional healers coming together with homeopaths at community clinics. There's current community clinics in KZN like Kulu. There's also the Okuba, which is in Warwick, where we are trying to incorporate traditional African medicine with homeopathy to bring about awareness. So we can hope that we can grow and the government can maybe recognize traditional African medicine and homeopathy together, so we can have healthcare that's more accessible to all South Africans, because that will lead to building a healthier nation, and it's a more inclusive healthcare model.
Absolutely. All right. Well, Bianca, last word from you as president of the Homeopathy Association. How are you working towards getting what Tarushka just described as that permission from government or that recognition?
Absolutely. Yeah. So we've actually this year, May, submitted a memorandum of understanding to the Department of Health in partnership with African traditional practitioners, looking at it from the perspective of we are regulated. Let us pave the way so that when our African traditional practitioners are regulated, there is already a system for them to fit in. So we are in this really exciting time where the Department of Health, and our discussions really started at Sedibeng District Health, which is doing phenomenal things in the area. And so we are there. We are ready. We are poised. We are absolutely ready to jump in.
Look, whenever you need a guinea pig, I'll try anything once, twice, maybe even 3 times. You can test anything on me.
Fabulous.
Thank you very much, Bianca de Canha, Tarushka Naidu, for joining us from KZN. Thanks for that, and we'll watch this space very closely.
Thank you, please do.
Thanks for joining us, ladies. Well, we'll have more news for you on the other side of this. You're watching All Angles here on ENCA.